Hello everyone, welcome back to Gentle Guide RN. Today, let's talk about person-centered care. It is more than just a buzzword. It is a way of showing up with dignity, with respect, and with the understanding that every person, every patient in front of you is the whole human being. They have their own story, their own pain, and their own perception of the world. We may not agree with them. Sometimes we may not fully understand them. But our job is not to judge. Our job is to care. You see, in some cultures, a male caregiver is not acceptable for a female patient, and vice versa. You might walk into a room and be greeted with warmth, or you might face rudeness, frustration, or even hostility. But remember, that behavior belongs to that person. You are not there to fix their personality. You are there to support them through what might be the hardest day of their life. So what do? We stand on our ground. We guard our dignity, and we advocate for our patient, and we give the best care we can. You don't have to be perfect, but you do have to present, and you do need to be honest. If you don't know something, say, I don't know, but I will find out. When I worked in a busy public emergency department, people constantly asked this one question. Excuse me, but how long do you think the wait is going to be? If you ever been into an emergency department as a nurse or as a student, you know how chaotic it can be behind the curtains and how busy we can be. And the truth is, often we don't know. But instead of brushing them off like, oh, you know what, I don't know, it's going to be a while, I would say this. I understand it's a long wait. Are you comfortable at the moment? Would you like a glass of water? Are you in any pain? Do you need any pain relief? Not all of these questions at once, but I look at the patient, and if I think they may need something, I would ask. And it's okay to always ask, would you like a glass of water? Or are you comfortable? Would you like a blanket? Because that always seems like kind and caring. Because person-centered care means seeing the human and make sure they know that we see them too. I experienced this patient-centered care when I was a patient and was undergoing a diagnostic procedure. It was a procedure where they do the procedure on you. It is a bit painful, and they can see the scans at the same time. Even though I knew what was going to happen, and I am a nurse, I was very nervous. And pain is the same with everybody. But when I went into that department, the nurse there made me feel like she's focusing on me, she's caring for me. She was radiating with this kindness and care. She always made sure that I'm comfortable, talked me through the procedure. She was with me all through the procedure. And I felt that, my goodness, she really likes what she's doing. And I remember thinking, I want to be a nurse like her. Because you don't have enough opportunity sometimes to talk to your patient while you're in the emergency department. Person-centered care also means the small things. Like when your elderly patient is discharging home, making sure that they have their wallet, their glasses, their walking stick, and they are getting home safely. Or you go in and discuss your treatment plan or care plan with your patient, making sure that they understand everything and encourage them to ask any questions. Like, do you have any questions? Please feel free to ask. And if a patient had a bad experience with another healthcare professional, if it's a doctor or a nurse, just reassure them, this is how I do it and this is why. Never dismiss any question as silly, because what sounds simple to us may come from a very real fear or need. Make sure your patient's dignity and safety are respected until the last moment of your care. This is what person-centered care looks like. It is not fancy, it's not always fast, but it is always human. So be present, be real, be kind. That is the nurse the patients will remember. And that's the nurse I know you can be. If you like this video, give it a thumbs up and subscribe to the channel for more gentle support and guidance. I am Nimi. This is Gentle Guide RN. I will see you on the next video.